Hello, Dr. Vikki Petersen here. A reader writes in about his wife who has been suffering a lot of digestive complaints, and they're wondering if she has celiac disease. She's made an appointment to have an intestinal biopsy, and his question was, is that adequate? The doctor plans to take 3 segments or 3 sections when he performs the biopsy, and this husband wanted to know, was that adequate, and anything else that they should do to really get to the underlying cause of his wife's digestive symptoms. That's a very excellent question, and one I could probably spend an hour answering, but I will abbreviate it as best I can. So here, the situation is this, is if a doctor performs an intestinal biopsy and it's positive, that means that the intestinal lining, or known as the villi, the finger-like projections that make up the surface area of the small intestine, have been completely mowed down or eradicated, and that's a positive test. And so, if one receives a biopsy and the test is positive, well, then you know for sure you're celiac. However, what if that test is negative? Does that mean that gluten is not at all a problem for you? It does not. It does not mean that at all. So there are several questions I would ask. Number 1, has this woman had any blood testing for celiac? The transglutaminase test, the endomysial test. Now, these blood tests have problems or liabilities as well, in that they are positive a very high percentage of the time when someone has celiac and once again have those little villi all but mowed down. So do understand that when you're at that stage of degradation of your small intestine, which is a very, very important organ in your body, you have been malabsorbing for such a long time. There's so many secondary health issues, including autoimmune disease and cancer, that can lie in the future of someone who's in that sort of state, that certainly while making the diagnosis is great, because now the person can start to heal and make some changes, what we're really after is making that diagnosis earlier. So even if this woman had had those blood tests, the standard celiac blood tests, plus had the biopsy, if all of those were negative, she'd still not be out of the woods as far as gluten perhaps causing a problem in her health. So I do recommend the immunoglobulin A and the immunoglobulin G blood tests for gliadin, because those tests are much more sensitive. They're going to show a reaction of the body's immune system to gluten or gliadin long before that small intestine has been completely degraded. And the concept of the biopsy, going back to that for just a moment, as being the gold standard of celiac diagnosis, that is becoming antiquated as far as recent research in the past 5 years. So what the scientists are saying is that it is so gross of a test, meaning so much damage has to occur before that test is positive, that it's really not what we need. We need a more sensitive test. And at the moment we have 2. We have the immunoglobulin test that I just mentioned, and we also have a very simple, inexpensive test called elimination and provocation, meaning you eliminate gluten from your diet for a month, 3 weeks minimum, but I would recommend a month, and then see how you feel. And that is considered a positive test, and is considered the most positive test as far as sensitively letting your body tell you if you're having a reaction to the substance. So please don't let anyone negate that as far as being a very positive, sensitive, and important test of changing your diet. But you must be vigilant and you must be accurate about changing your diet. You can't half-heartedly get gluten out of your diet. It must be 100% as best as you possibly can in order to really see if this test is positive for you, meaning you feel better being off gluten. Entera Lab is a lab that you can go online and get a test, and you don't have to be consuming gluten at the time, which is nice. So if you've been off it a few weeks already, you can still do the Entera Lab. That starts with an E, enteralab.com. So you can go online and get that test sent to you and do the test yourself. So there's been a lot of wonderful change in the area of gluten sensitivity and celiac disease. We've been a bit stuck with the biopsy and the blood test as being the only true diagnosis. And what we're realizing, and I've realized this as a clinician, as has the doctors that work with me, but what science has realized is that these tests are not what we need. They're too little too late. Certainly having it done and being positive, of course, now you know. But what about those people that are told because the test is negative, they're fine? And for many, that's a falsehood, which is why we diagnose so few celiacs percentage-wise, and so many people are suffering from gluten sensitivity unnecessarily. So I hope that helps, and until next time, I wish you very good health.